Premier Heating and Air is now offering free home energy audits. Call Premier Heating and Air now at 478-300-2633 for your free home energy audit. Premier's professional technicians will inspect your vents and duct system for cleanliness, inspect your attic insulation, check your indoor air quality, evaluate moisture barriers, and more. Log on to dublin.premierishere.com or call 478-300-2633 and experience a Premier difference today. Premier Heating and Air, a locally owned and operated company. This offer ends 1/31/24.
Welcome everybody. I'm glad to have with me today my dear friend and fellow ambassador with the Dublin Lawrence Chamber of Commerce, Caleigh, and I'm going to say Haskins Neal, because I think the last time I interviewed her, she was Miss St. Patrick's.
It's been a while.
Yeah, a lot of changes. You done got married and got other plans in the making. And tell us a little bit about your family, first of all.
Well, I'm married to Ryan Neal. Together, we're expecting our first child in July. Right now, we have our fur babies. We have about 3 or 4 dogs that we treat as our own. We've got a house full. It's always fun. I'm the daughter of Brad and Dina Haskins. I have a brother named Carter Haskins, who is 16 years old. He's at West Lawrence High School. And just always grown up in Dublin. I love coming and talking with you. Just a good opportunity to get some good information out into our community.
It is, and Caleigh has joined the team at South Central Health District, and I tell everybody this, but when COVID first hit, Dr. Kraft and Don Avery were the faces, and they'd have press conferences, and we'd ask them questions. And I say this jokingly now, please don't, I'm just telling you how comfortable I felt with them at the helm. But I told several people, I said, we could have a nuclear bomb headed toward Lawrence County, and Dr. Kraft and Don would make it sound like, oh, well, that's just a nuclear bomb, because they're so calm and they laid the facts out. And I know Dr. Kraft had not been in that position a long, long time, but it's just amazing. It's amazing how they handle that situation. It was terrible. It really was. It was very bad. COVID's not the same now as it used to be. But before we get to COVID, I want to talk about the flu, because listening to my doctor, listening to other doctors, and I think January 5th, the CDC issued a total breakout of flu in the state of Georgia. Right. Tell us about that.
So this year we are seeing elevated numbers of flu cases, especially in Lawrence County. November and December were increased levels, and then as to be expected, after the holiday season and back to school, we are still continuing to see numbers rise in our school-age children and adults as well, returning back to work.
Okay, every September I get my flu shots. Me and my wife, we just know September we get flu shots. I believe, I'm not speaking on behalf of y'all, but I believe if you got that particular month and you try to hit it before it starts and get it in your system, I think you can remember it better. Right. But when I'm there, it's a lot of older people like me getting it. But children as young as 6 years old, they're recommending flu shots, aren't they?
Yes, right. Actually, children can begin getting the flu shot as early as 6 months of age and older.
How about that? Well, and our schools, I'm out there quite often, and these kids, we know if this foot and mouth disease starts spreading, it spreads through the school, because they're bringing it home, give it to mom and daddy, possibly. They go to work, go to church, so it's easily spread. So as young as 6 months, that's incredible. I would do that if I had a 6-month-old child. Right. But what are some things we can do? And I'm glad we're not doing a close-up, but I wash my hands so often. They're cracking, and I have to put cream on them multiple times a day. But I know that's one thing. But what are some things we can do to help maybe not spread flu? Right.
So there are several things that you can do to reduce the risk of spreading the flu. One being, like we said already, washing your hands. If you don't have water and soap available, at least some type of gel-based hand sanitizer. Another thing is respiratory etiquette, using the inside of your elbow to cover your cough. If possible, grabbing a tissue to sneeze and cough into, and then disposing of that then washing your hands afterward. It all kind of ties back to hand washing. If you know someone is feeling unwell, they're running a fever, they're showing symptoms, making sure we distance ourselves, especially in the home. I know it can be very difficult to isolate from family members, but as best you can, try to isolate family members who are feeling under the weather. Remembering that if you have a fever, you need to be fever-free for at least 24 hours without the use of a fever reducer before returning to work or school. That's a huge component of reducing the flu in our communities, is that fever. I always say if you have a fever, then you need to stay home. And then that 24-hour baseline is a good way to remember to like how to go back, when to go back to school is a good timeline to look at.
Absolutely, that fever. Okay, and y'all, I promise you I'm not trying to talk down about this, but you know, washing your hands, there's a certain technique. It's not just stick them underwater,
Right.
you know, dry them off and go on. Expand a little bit more how we should wash our hands in a proper way.
So proper hand washing protocol, if I went through the certified nursing assistant classes in high school, so I got the nursing side of things. But a good rule of thumb is to sing happy birthday to yourself while you're washing your hands, making sure that you're getting enough soap and applying enough water to create a sud when you're washing your hands. And I even like to take it so far as to wash up my wrist a bit, just a little bit, just to make sure I'm getting it good up to my thing, like when I'm laying my hands on a counter.
That's right.
Doing anything out in the public.
Yeah, and like I said, it's so important, and using that warm, I use it a little too hot, as a matter of fact. I have to take my hands out, but I think that the hotter that water that you can take, I think it's so important, but washing hands, I never thought about it, and I don't do that, so that was great advice to come on up past your watch. I guess, like you said, just picture yourself leaning on the counter at the post office or whatever.
Right.
So great information. Well, we're going to take a quick break, and we'll come back right after this.
Hi, I'm Dr. Dustin Gay. I'm a local orthopedic surgeon with Houston Clinic Orthopedics, and we'd really like to invite everybody to come out to our new office facility to take a look at it. It's a larger space with physical therapy, and we're just excited to have it, and we'd love for people to come out and visit us.
Come by and see us today at our brand new location, the Houston Clinic, Medical Drive in Dublin.
Hi, I'm Tom Dominy. Here at Dublin Wind Nelson, we pride ourselves on providing the industry's highest quality products at the most competitive pricing. We are a full-service wholesaler specializing in plumbing, irrigation, and industrial products. With a staff that collectively offers more than 50 years of expertise, our team knows your industry, and we can answer your questions and help you get the parts and equipment you need. From Moen to Renee, we carry the plumbing, irrigation, and industrial products you need from the brands you trust. We also carry a great lineup of Milwaukee tools. At Dublin Wind Nelson, our goal is the long-term success of your business. We achieve that goal with a simple commitment, doing things right, one customer at a time. If you have a question, or if you're looking for a hard-to-find part, give us a call. Our experts are ready to help. Order online, give us a call, or come by at 507 Airport Road in Dublin. We're committed to building long-term relationships with our customers by earning your business every day.
First Lawrence Bank invites you to experience banking at its best. Whether you have personal or business needs, we're a full-service bank big enough to handle all of your banking needs and small enough to provide you with that personal touch you've grown to expect from a community bank like First Lawrence Bank. Looking forward to your future? That's First Lawrence Bank in Dublin and Dexter, member FDIC.
Welcome back, everybody. I'm continuing my conversation. If you're just joining us, I have with me Caleigh Neal today with South Central Health District. And if you are just joining us, you can also watch this program on our YouTube channel, which we want to thank hundreds of thousands of people that watch every quarter that come to our YouTube channel. It's amazing, Caleigh. I say this often, but people my age, we watch television. People your age, they're watching it on their iPhone, iPad, whatever, you know. It's got an I usually in front of it, and that's okay too. However you're watching us today, we appreciate you tuning in today. It's some great information. Okay, COVID. We talked about flu, but COVID, you know, a lot of people think, well, that was a couple, 3 years ago. Well, we have made strides
Right.
in COVID, but, and listen, I'm just going to tell you, I've been criticized for this part, but I've had all my COVID vaccines. I've had my booster vaccine, and I have not went for this latest booster, but I'm waiting to hear what Caleigh says today, if she's going to take me on down there and give me a shot or not. But look, we live in America. If you don't want to take the vaccine, that's cool too. So, but you know, I actually think we ought to take it. But you know, I have a lot of friends that think the opposite. So, and I respect that too.
Right.
So, okay, with all that disclaimer out of the way, what about COVID?
So COVID is, I like to say that COVID is a lot similar to the flu. We're seeing COVID cases as well as flu cases this season. And I think that the best way to prevent, just like the flu, which I didn't mention earlier, is to be vaccinated for COVID. And things have gotten a little tricky with COVID vaccine protocol. Depending on your age, which vaccines you've been given before, there's different boosters that would apply to you. And so on an individual basis, I would recommend that you call our Lawrence County Health Department and ask which COVID vaccine that you would need, or your primary care provider. And they should have on record what you've had or had not had and what you would be eligible for now to really try to decrease the spread of COVID and the flu as well. The flu is just the one shot, but the COVID, it can be based on what you've had before and your age.
That's right, and we're going to talk a little more about vaccines in a minute, but I've told many people in other parts of Georgia that South Central Health District could have went and trained other people, because when this thing broke out, y'all opened up at Southern Pines, and me and my wife, which are main caregivers for my parents, which are 85 and 86 right now, but we all got in the car, me and Dad in the front, and Mom and Julie in the back, and we rode over there, got in line, we were out of there probably in 10 minutes. You know, it's a very short time. Roll down the window, bam, 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 you know, and you off to the races. And we did the same thing for I guess the booster, the follow-up, however many, 4 to 6 weeks, I think, later. But it was incredible, the organization. And the reason I bring all this up, y'all are so well trained. Training is a big part of the job you do, isn't it?
Yes, it is. Thanks to our amazing emergency preparedness program, we actually do a flu clinic every year in each county that trains our staff at each county as well how to do a drive-through vaccination clinic. And so I think we were very prepared. I can't take credit. I was actually still a college girl around
That's
that
right.
time. But to this day, like, I still hear great things about how the mass quantity of people coming through were just handled as quickly as possible, and everybody was, for the most part, I think, very pleased with how that went down.
It was. If you wasn't pleased with that, I don't think you can be pleased, but it was incredible. But Melissa, which we have had on many, many times, Melissa Brantley, but Bradshaw Brantley.
Right.
I still call people by their maiden names. I don't know why I do that, but she told me for years that they would train every year for something like that COVID. Never heard of COVID, but every year they would train for a mass type breakout.
Right.
And she said, James, I didn't think we'd ever use that. And then all of a sudden, bam, COVID hit and they kicked into gear. That's why it went so smooth, because you trained kind of like the military. You train for those tough times like is happening around the world right now. But that training is so important. And I want you to understand that you're in the hands of well-trained people, no matter what the situation is. Hopefully we won't see anything else like COVID. But you're right, I believe COVID is kind of like the flu now. I think it's here to stay at some degree, but we just need to keep getting vaccinated, I believe. And like I said, if you don't want to, that's fine too. But staying on course with vaccinations, what other kind of vaccines do you do, and what should we do?
In regards to COVID, or?
Yes.
So with COVID, it really just depends on what you've gotten, because I think we're coming up on the 4-year anniversary of the state of emergency for COVID. So within that span of 4 years, you may have gotten your 2 initial vaccines and then several boosters afterward. And so just depending on what the CDC has recommended per age, like I said, if you're concerned about what vaccine, if you may be up to date for needing a vaccine, or you're not sure if you're up to date on your vaccine, give the health department a call. Our website here, you can find all 10 county health departments, phone numbers, and addresses available for you to go check that information out and make sure that you are up to date on your vaccinations.
Okay, and that you've been seeing it on the screen as we talk, and we'll continue to show it. Just jot it down. Okay, vaccinations like for kids. You still, at a very young age. I know I took my 6-year-old grandson to Dr. Helton the other day, and he was excited to hear he don't need any more vaccinations until he's 11. So he's thinking, man, that's 5 years away. I don't have to get another vaccination. But that is so important to check with your pediatrician. Make sure, just like with Paxton, that that's why you want a good doctor or a good health department. But what other vaccines do you do at South Central Health or through the health department?
So we do quite a large amount of vaccines. I know one big one, it is Cervical Cancer Awareness Month this month, and we do offer the HPV vaccine, which is a huge component to feminine health. Just making sure that we're checking all the boxes and protecting ourselves as best as possible. Let's see, we've talked about flu, we talked about COVID.
Pneumonia? You do pneumonia shots?
Off the top of my head, I want to say yes.
Yeah.
But if any vaccine comes to mind and you wonder if we offer it, we probably do. I can't guarantee right here. But just like I said, give us a call and we can answer all those questions for you from the health department.
Yeah, and the website. That's so important. I know when I went on the website recently, knowing we were going to talk, it's easy to use. You just go right through it, everything. Some websites, people make it difficult to maneuver.
Well, we revamped our website.
It's great.
Yes, about 1.5 years ago, we started from nothing, and we built it back up because we wanted it to be so user-friendly.
You got that part right. Oh, it was incredible. So just go on there. You can click on, and as a matter of fact, all 10 counties are listed. You click on the arrow, it drops down. It'll tell you the address in Eastman on Oak Street, I think I saw, and whatever phone number is 374 something anyway. But you can get that information too if you're watching us now in Eastman or one of these other surrounding counties. So we're going to take another break and come back and wrap things up.
All right, boys, if you want to go to college, you have to clear out another one of these.
What if we told you there was a better way to save for your kids' college than pickle jars? Morris Bank's Savings Builder account and moolah makes saving for your kids' college easier than ever. All you have to do is connect the account to your debit card, where it automatically rounds up your purchases to the nearest dollar, depositing that spare change into a moolah account where it will grow into a nice little nest egg for whatever your kids have their sights set on.
Hey, I'm TJ with Dublin Outdoors and Power Sports. We're Middle Georgia's largest Can-Am ATV and side-by-side dealer. And we have all the accessories to make your Can-Am look and perform at its best. Come on down and see us today. We can help you make this Christmas more exciting and enjoyable for the entire family. Dublin Outdoors and Power Sports, 301 North Jefferson Street in downtown Dublin. So join us in celebrating the birth of our Lord and Savior, Jesus Christ. Merry Christmas and a Happy New Year to everyone.
You ready to meet the latest addition to the family? The money you saved us with auto owners helped make it all possible. It really is the best thing that's ever happened to me.
Excuse me?
Third best thing.
Third best thing.
Auto Owners offers discounts for life, home, car, and business insurance because they think the more you protect, the more you should save. That's simple human sense.
Ask Curry Maffin Insurance in Dublin and Augusta if auto owners make sense for you.
Welcome back, everybody. We're going to wrap things up. I was at the First Church of Nazarene yesterday talking to Miss Hicks, Don Hicks, the pastor's wife, and I see signs as I pull up, COVID testing. And I know you did it in the height of COVID, but I didn't realize you could still do that. What's going on with that?
Right. So we are offering free COVID testing Monday through Friday, 9 a.m. to 2 p.m. at the Nazarene Church right here in downtown Dublin.
Okay, that's really convenient. You know, you don't have to find parking. You just drive through, I guess.
Right.
Sit there in the car, just like we talked about original testing. So, we still have that website up there for you. And if you'll just jot that down, we're going to close in just a second. But tell me, are you glad you went to work with South Central?
Oh, well, in college, I'll just give you my little backstory. When I first started Georgia Southern, go Eagles, I was convinced I was going to be a nurse. I was going to come back to Dublin as a nurse. And then I got there and I realized I did not want to be a nurse after all. And after some time of not knowing what in the world I was going to do, I came across a degree in public health, which was very small at the time. This is 2019, so just think pre-COVID.
Yeah.
And I started getting involved in public health classes, and I realized I think I could like this for the rest of my life, because that's a big decision I was making. And so once I graduated in December of 2021, I began doing the job search, and thankfully I got my foot in the door at South Central Health District, and it's just been like a movie. Ever since, I've been in several positions, including when I first started, I was doing COVID contact tracing, and then I started doing opioid analyzing, watching for overdoses in our community, educating our community on the dangers of the opioid epidemic. And then now I find myself doing a little bit of both. I'm wearing several hats right now. I'm the marketing coordinator and a health educator in the opioid epidemic. And so it's really been a fantastic opportunity for me to give back to the community. I always said, whatever I do, I want to give back to the community that gave so much to me as a child growing up. And so this was the perfect opportunity for me to get out and do exactly that.
Amen. That's one of the reasons I do what I do. I was supported so much growing up. No matter if we were selling stuff or FFA or whatever it might be, that people always supported us, loved us, encouraged us. And it is so fun to come back and give to that same community that gave to both of us, and many of you watching today. But I can tell you this. Everybody knows I have a homeless ministry, but you also supply me with Narcan, so that we use quite often. We had a sidewalk Bible school recently, and we did, through Rise Up, we did fentanyl's test strips, and then we did Narcan training. They were lining up. We went around and put the word out in the homeless community. We had hamburgers and stuff like that. That didn't really turn them on. They might come, but when we said fentanyl test strips, they came running. And you may think, why would you do that? Well, we want to save their life until possibly can reach them and get them off of this. And I will tell you this, how important this fentanyl test strips are. Chief Moon with the Dublin Police Department told me that in the last 6 months, 100% of the marijuana that they had confiscated tested positive for fentanyl. So if you're out there today and you say, and I talk to many people and say, James, it's just pot. I'm just smoking pot. This is not, you know, taking a line from Buick or Oldsmobile. This is not your daddy's marijuana. You know, this isn't marijuana from years past. They are lacing this with fentanyl now. And my biggest questions I have, Caleigh, they'll say, well, James, I can't believe my drug dealer would want to kill me. I said, he don't. He wants you coming back to him.
That's right.
And if he mixes he or she they put a grain of salt in there, and you got to realize if you put 3 grains of salt, literally grains of salt, 3 grains of salt could kill you. And that 1 grain was going to just make you higher and make you come back to him. So fentanyl is killing people. We lose, in the last 12 months, we lost 12 to 15 people in the homeless community from overdoses. Mostly shooting up heroin laced with fentanyl. So, y'all, this is something that that is so important and so you need to be on your P's and Q's. And you say, well, I don't do drugs. Well, I have a friend in my Sunday school class. Her relative, I think cousin, works at a construction crew in Valdosta. They're working there. And these people come by and gave them water, bottles of water. They thought they were doing it just to help them out. Well, it was pure evil. The water bottles were laced with fentanyl. And they start falling out, several, I think 6 or 8 falling out. A few of them almost died. They were critical, but don't take stuff from other places. Take your own water with you. Just, you know, be careful if you're out in a bar or whatever, if that's what you do. Keep eye on your drink, because this fentanyl, it's so dangerous, and I know you see that in what you do.
Just from a statistical side of things, fentanyl is 50 times more potent than morphine and 100 times more potent than heroin.
Wow.
And so, I mean, like you said, a grain of salt's worth. I mean, that's all it takes. And touching on the dealer situation, they're trying to make $1. Fentanyl's cheap and it's quick and it's easy. Yeah. And there's a billboard actually right up the road over here, and it talks about like what's actually in your drugs. And there's things like bath salts, rat poison, and you really just don't know what you're putting in your body at this point. And I think it's very important that the community knows that these things are floating in our community. And I think as a community, take a stand against it, and we don't accept that here. We don't want those things killing our people in our community.
Amen. It's our neighbors, y'all. It's our friends. A lot of times that just don't realize what's going on, but it is killing. It's killing people. We ain't talking about in Atlanta. We're talking about Dublin, Georgia, and it's in your neighborhood. I don't care how nice your neighborhood is. It's there. It's rich kids, poor kids, black kids, white kids, Hispanic kids. So to me, it's worse than COVID because we're poisoning these people. So, but anyway, so you can get all this information through South Central Health District. We're just touching on just a drop in the bucket here, but please go on that website. I know you done wrote it down because we're about to close. So I was trying to give you the opportunity to get a pencil, but like I said earlier, if you're watching us on one of our platforms, YouTube or Facebook or Twitter or Instagram, there's so many places to watch us now, but just go back and watch this and write that information down. Well, thank you, my friend. I appreciate you talking to me.
Thank you for having me.
Absolutely. Look forward to many more interviews, and we're going to try to get some of these nurses in and some of these that specialize in certain areas because South Central and the TV station thinks this is so important for our community. So thank you. No matter how you're watching us today, thank you for watching us right here on TV 35.
Hi, I'm Brandy, and I would like to invite you to experience our newly renovated mammography suite at the Fairview Park Hospital Breast Center. Our breast center has its own dedicated entrance with a relaxing boutique-like waiting area. You can make your appointment online anytime at fairviewparkhospital.com or by calling 478-274-3919. Most appointments take 30 minutes or less, and we will have your results back to your doctor within 24 hours.